Good afternoon and welcome to our quarterly support coordinator meeting. And thank you for coming. It's great to have you all here. Just a reminder that this meeting is recorded and it'll be available Friday on the DSPD website. And we'll go ahead and put a link to that section in the chat. Please mute yourselves and type any questions into the chat box to try and help manage feedback. And I really just want to say that we really appreciate all of you and the work that you're doing, the work that you do on an individual basis to help support people, assure they have really quality services, quality of life, are meaningfully engaged. The work you do is really critical to making a difference in a person's life. So thank you for that. And thank you for your patience as we work together, as you have questions and as we partner to continue to make any needed changes in our system. On our agenda today, we'll be going over announcements, staff changes, updates of how things are being implemented post the legislative session. We'll have Carrie here to give updates on from the Office of Service Review. The finance team will give us some updates as well as get some person-centered planning training from our team, and then housing training. And then we'll have it open for Q&A as well. So on our announcements, first, we are currently piloting an experience survey for individuals who have recently completed their person-centered support plan meeting. You can really help us with this process by updating email and mailing addresses during the planning meeting. And if you have questions about the survey, you can contact our person-centered planning team and we'll put the email in there for you to contact them. Also, we've had a lot of questions about activating new plans with restricted service codes. A majority of these questions have centered around the Employment Preparation Service, or EPR. EPR is time-limited, 24-month service. The service dates don't always match with a person's plan cycle year. In order to activate a plan, support coordinators need to go into the budget screen for the person-centered support plan and change the date to match the EPR information in the restricted code table. The same restricted services data can also be found on the budget screen in the person-centered support plan. If additional EPR time is needed for the person, please create an RFS for an EPR extension close to the expiration date. All requests to extend the EPR service are individualized and should be a one-time RFS request. If you have any questions, please reach out to the USTEPS or Employment Planning and Inclusion team. We'll get those emails in the chat as well. And then staffing changes. Tenzin Sopa is new on Mel's team. That's our finance team. Adriana Casillas is the new waiver manager for the community supports waiver. She comes to us with years of experience. She comes from a provider. We have Abby Harding. She's a registered nurse for the physical disabilities waiver. Brianna Jones has now joined the ESMC, our emergency services team, as a caseworker specialist. She'll be working with people who are entering services through ESMC for that first year. She brings great experience from the community transitions waiver team. We're really sad to see her leave that team, but we're excited to have her working on the emergency services team, which highlights for me, I should have said this earlier in the announcements. One of the things that we are doing is we will have 2 support coordinators working with people as they come into services through emergencies. We've found that there are a lot of, there's just a lot of change. Sometimes when people are in crisis, they may be back in jail before they come back out. Getting services coordinated can get a little tricky, and we want to make sure that we're able to move forward as quickly as possible. We appreciate all the work that people have been doing on these. And we have seen how effective it has been for the community transitions waiver to be carrying those cases for 1 year before transferring them. And we're hoping to be able to see something similar. So we look forward to partnering with you in a little bit of a new way, but we're really excited for the possibilities that we see. Maxie McKay and Sandra Salazar Hernandez are new on Jeff's team. That's our intake waiting list team. Jen Eliason, she's new on our U-Steps team. And then many of you may have heard already, on a sadder note, Jamie Withridge is now at HMHI. So I'm really, really sad to have her go. I'm really excited for her because she is incredible, and anywhere she is going to benefit. But we will be needing to look to replace Jamie, but really, really filling that void. On our legislative updates, so many of you may have seen or are getting calls from people about a recent caregiver compensation article that KSL ran. So when people are calling us, we're directing people in services to their support coordinator if they have questions about caregiver compensation. We've also been getting questions about accessing caregiver compensation while on the waiting list. So if you get questions about this, it's only available to people who are getting certain one-time services, and you can just direct them to call the waiting list worker. We are still working on finalizing a caregiver compensation plan. Our goal is to have this in place by November 11th. And just let you know where we're at in the process. So there will be a 30-day public comment period. It will be going to public comment really soon. We'll make sure when you know when it goes to public comment so that you have an option to review it and give input. After the public comment period, our plan has to go to CMS, and they have up to 90 days to review it before it's implemented. And of course, if they gave us feedback on it, we would need to modify anything based on that feedback that would, depending on what they're asking. So with that, I'm going to go ahead and give time over to Carrie so she can talk about the Office of Service Review.
Thanks, Angie. We just have 2 quick updates. First of all, I just want to let everyone know that we are working on updating all of the review tools for fiscal year 24 and are hoping to get them on our website by the end of this month so that everybody can have access to them. We'll also, with those review tools, will be our site visit, unannounced site visit tools that we use so that you all can see what we're looking at and the questions that we ask there as well. And then we had a request to create a guide to what service codes require a quarterly, monthly summary and which ones do not. So we created a quick visual for that it'll also be posted on our website. It's not yet, but I know it just got posted in the chat so that you can see what that looks like. We hope this will be helpful. So you know when you should be expecting a quarterly summary, when it should be a monthly summary, and when a service code doesn't require either. If you have any questions on those, feel free to reach out. And that's all for me, Angie.
Thank you, Carrie. Amanda Barr, let's hear. We have Amanda Barr on to talk about UCANs.
Yeah, I'm here. All right. So just kind of some quick updates because of the new PCSP plans. If the case does not have an adult CIS or a previous UCANs, you will need a UCAN. So if there's a child CIS, if there's neither one, there's neither a CIS or a UCANs, you have to get that UCAN sent. So please look ahead. You can do the UCANs up to 60 days before your PCSP plan ends. So please just look ahead. You can schedule it with any assessor. You can email me directly to get it scheduled for you, but please don't wait until the end of the month. If you see a plan coming up in the next month or so, please go ahead and get it scheduled throughout the month so we don't have a whole mad rush and people not being able to get in the last week of the month. There's also a wide variety of time slots open the earlier you do it. So August, we're going to have a pretty slow UCANs month. So if you have any PCSPs coming up September, October, get them done in August. Let's get it done so we can get them all over with. Right, next slide. One of the things that really helps when we are doing the UCANs is having an updated PCSP. I have been doing a UCANs myself where I started talking about asking if the client still enjoyed going and running the tractor with grandpa, and it come to find out grandpa passed away 2 years prior. So please make sure those PCSPs are updated or the person-centered profiles are updated so we don't have any awkward or uncomfortable or triggering responses from the clients. We want to make it as comfortable process as we can, lighthearted and easygoing. So please just keep them updated. I've seen several person-centered profiles where the age is incorrect. It's 3-4 years and out of date. So just take a quick look, take 5 minutes. Please update those profiles. And also when you're in a UCANs, we're on camera. We prefer as many people that can be on camera to be on camera. So if you're there, please show up, turn your camera on, be active in the plan. Even if you've only been working with a client for a couple weeks, a month, please just be as active, participate in the thing that makes the whole situation a lot better, because the clients are looking to you as their support coordinator to kind of lead, and things go a lot smoother when there's participation from everyone on the team. And I think that's it for me.
Thanks, Amanda. We have Kristen here for finance team updates.
Hi, everyone. Just a couple of quick updates from the finance team. So in April, an email was sent to all support coordinators requesting that you verify that any individual on your caseload who is receiving massage services or SSM services had a valid referral or prescription. We got a lot of prescriptions updated. We really appreciate that effort made by so many of you to ensure those were valid. But there still is a few individuals who have SSM services in their budgets that don't have prescriptions. So starting next week, DSPD's finance staff will be completing a final review of individuals with SSM services in the budgets. And any individual who does not have a valid prescription will have that funding for massage services removed from their budget. We'll send out an NOA to the individual with the opportunity to appeal. And then if going forward, if SSM services are requested, RFS requests will need to be submitted. And we're going to go forward and continue to do reviews periodically of the prescriptions to make sure we have valid ones. And just as a reminder, if anyone has any questions, for the prescription for SSM services needs to be a written referral from a DOPLA licensed healthcare professional, and include the person's name, the specific massage therapy service that's required, and the specific length of a session that includes duration and frequency. If you have any questions about the prescription, if it matches what we're required and what we're looking for, just send me an email. I'm happy to look at it and go over it with you. The other update is just a request coming from the RFS communication group. We appreciate the time and effort you spend advocating for the clients on your caseload. Just as a quick reminder, really try and keep that committee as objective as possible. They're tasked with just looking at things without any outside influence, just looking at those documents objectively. So because of this, the RFS request and use steps should really be the main form of communication between any support coordinator and RFS committee member. That ensures the entire committee has all of the relevant data. There may be situations where additional questions occur about the process. And in those cases, please reach out to the RFS committee member reviewing the case. They're happy to help with that kind of information needs. But just make sure those requests are just focused on the process and they're not trying to sway a committee member's decision. And similarly, any correspondence with RFS committee members should come from support coordinators and not individuals or family members. And of course, any decision that's denied or is not in what the individual or their family would like, they will send out the NOA and they'll have that opportunity to appeal it if they disagree with any decision. So just trying to keep most of the information right there in the request so that everybody can look at it and be informed when they're looking at that review. If you have any questions, reach out to myself or reach out to Kimberly We're happy to help with that too. That's all from the finance team.
Thank you, Kristen. Now we have Lisa and Timara here to talk about person-centered planning.
Thank you, Angie. It's great to be here with you. We were talking about some person-centered planning competencies and what that looks like. We presented the first one in our last meeting, so we're going to talk about the second one today. So we'll start with DSPD's employment and inclusion value statements. So connecting today's training on person-centered planning to these statements, you can see connections under all three values. That quality person-centered planning focuses on having the person as the expert of their own life, focuses on integrated employment as the first and preferred outcome for all people, and focuses on that community connection and community access. Employment is one of the main ways that people explore their interests and make connections and hold value in their communities. So these are 5 of the competency domains for staff who facilitate person-centered planning. And this was published by the National Center on Advancing Person-Centered Practices, or NCAPS. And you can download the booklet from the NCAPS website, which the link will be put in the chat. They also have a plain language version, which describes those competencies in a way that's more accessible, and at least I can understand it better. So that link will also be put in the chat. And as I said, today we're going to talk about that second competency. And we're also going to talk about a resource that aligns with that competency in a minute. So as an introduction to competency 2, quality person-centered planning that cultivates connections first understands the system and supports a person may choose. And those choices can look different depending on individual and family situations. And choice is just one part of this competency. Good person-centered planning focuses on that universally valued goal of living a good life as defined by the person. All activities focus on the person as a whole, not just their diagnosis or disability, and are informed by the person's unique culture and identity. The last bullet point here is key. A direct link exists between a person-centered approach and ensuring activities, skill building, decisions, and planning is meaningful. As a person-centered system, we should always prioritize creativity and flexibility to make connections meaningful and lasting for the individuals that we serve. So we're going to dig a little deeper into the competency, and person-centered planning can include making decisions about a variety of supports a person may choose. This can include healthcare, recreation, housing, faith-based organizations, cultural groups, and more. So how familiar are you or the organization you work with the options available in the person's community that they may choose to access? If you and those you work with need more information about possible supports, we recommend creating a plan to find out more about the resources available in the communities of the individuals that you serve. This could mean looking at a Google map or going to the 211 website or talking to people who live or work in the area. Or I'm sure there are many more ideas you could come up with. So now I want to talk about a person-centered planning tool that can help you look at supports a person may have or need in their life. So the Integrated Support Start tool is used to identify the supports a person is already receiving in order to be living an inclusive quality life, along with determining where support is lacking and where you could add those connections. There are 5 different sections to the STAR. At the top is personal strengths and assets. That's that teal section. Relationships are the purple section. Eligibility specific or paid supports are green. Community-based supports are the blue section, and technology is that pink section. Each section represents a type of support a person may already have in place or those needed for the future. So for personal strengths and assets, you could put the skills, the personal abilities, the knowledge, the life experiences of the person. It can be things that they're good at or things that other people admire about them. Relationships can include friends and family. It can include neighbors, acquaintances, or church groups. Eligibility-specific supports are needs-based services based on age, geography, income level, or employment status. It can also include paid services based on disability or diagnosis. These are services that you must qualify for in order to access. Community-based supports include places, groups, membership organizations, local services, or public resources that everyone uses. These could be paid or you could access them for free, but everyone can access them. Technology can include anything from personal technology that anyone can use, like an iPad or a cell phone, or adaptive equipment or assistive technology or environmental technology, like a smart assistant that controls your lighting, or low-tech items like schedule boards or task lists. So we wanted to show you a sample of an integrated support star. So we created one for our friend Alvin Monk that you may remember from our software training. We listed some of the items found on his star on this slide. And this information can help you understand the supports and systems that Alvin might choose based on those available to him. And he's already familiar with some of those supports in his community and eligibility specific supports, but there are others that his support coordinator can connect him to. So if you'd like to see what it looks like filled out, there will be a link in the chat. We want to have a holistic view of the person relative to their community. Being person-centered means being aware of common issues related to different populations that may intersect with those you serve, behavioral or mental health needs, culture, identity, language, and more. We discussed some of these intersecting identities at our last quarterly meeting if you want a refresher. Next, as the support coordinator, are you connecting the person to their community in ways that are meaningful? This competency encourages us to look beyond those segregated activities designed only for people with disabilities and find ways to build friendships and meaningful connections outside the paid service system. Ask what relationships and activities the person prefers, and then clarify, respect, and support that answer. Now, if verbal conversation is difficult, identify how best to communicate with the person and give them a chance to share what they like. We met with a provider recently and learned that one individual that doesn't use words to communicate would click a pen whenever an activity was said that they were interested in. That was an extremely low-tech and creative way to allow someone to share their opinion. Now I'd like to turn the time over to Tamara Blackwater to discuss a new resource that we recently released. Tamara?
Thank you, Lisa. Good morning, everyone. I want to introduce a new resource called Community Integration, Strategies and Recommendation to Promote Connection to the Community. We'll put the link to the document in the chat. This resource consists of 5 activities to guide support team members, advocates, and our professionals like direct support staff, job coaches, support coordinators, educators, and supporting people with disability to meaningfully connect with their community. As you are reviewing the document, pay close attention to the 5 activities because we'll go more into detail in the next slide. The community integration document provides suggestions, recommendations to engage and support people with disability to overcome barriers to community integration and inclusion. Next slide, please. So let's take a closer look. It begins with a brief introduction of the document to support team members, advocates, and other professionals who are supporting a person with disability and community integration. A definition list is provided to give context and common language for anyone who may not be familiar with community integration. Throughout this guidance documents, there are references to a facilitator. So we also included the tips for a facilitator section. A facilitator is a person who is responsible for leading a discussion or activity. For example, a direct support staff is a facilitator in developing a community map with the individual and their family. These tips reinforce inclusion and full acceptance of the person as you are supporting them to meaningfully engage with their community. Each activity provides potential roadblocks to community integration and then offers recommendation and ideas, and then ends with a thought exercise for the facilitator at the end of each activity. So let's quickly go over each activity. Activity 1 is getting to know the person. So you're taking the time to connect with that person, build that relation toward trust and respect, and it can make the process easier to identify their strengths and interests. And one recommendation in this activity is building connection by finding common life experience with that person. Do both of you share a common hobby or activity? Activity 2 is strengthening the person's self-determination. So for a person with disability, strengthening self-determination means they have more control over the types of support and services they receive. It gives them the skills and knowledges to create a vision of their best life. And one strategy in this activity is assessing the person's independence. What can they do on their own? What connections have they already made? Activity 3 is helping the person to identify and strengthen natural supports. This activity goes into depth of why natural support is important and how they are essential in community connection. One strategy here to highlight is help the person and the family expand their natural support system. Extended family, friends, coaches, teachers, co-workers, church members, club members, community members, others can serve vital support roles. Activity 4 is developing a map of the person's community. This activity provides information and community mapping and how to create a community map with the person. One strategy here to spotlight is after you have created the community map with the person, next is to review and revise the map to ensure it has high quality, meaning is the map individualized and person-centered? Does the map focus on the person's interests? Does it use a format that the person can understand? And last, activity 5 is connecting to the community. All these previous activities build toward activity 5. And this activity provides how to support the person to be included and involved in their community. One strategy here is support the development of community connection. And how do we do that? We plan from the perspective of the person's culture, value, preference, and interests. And don't assume you already know what connections or resources the person or family needs. So I hope this new resource will be helpful to you as support coordinators in building connections between the person using services and their community. Next, we'll talk about another person-centered planning tool that supports the competency skill of actively involved supporters in collaborating, developing, and executing the person's plan when cultivating that connection inside the system and out. Next slide, please. The relationship map is a person-centered planning tool that can be used to show community connection and paid and natural support. It can assist the person with identifying people in his or her circle. And this tool can help you as the facilitator know who's part of their life and where more connections may need to be made. So the 4 areas of the relationship map is family members involved in my life, people and organization that support me at home. The 3rd area is friends, and the 4th area is people and organization that support me at work, school, or in training. It is available in U-Steps, and to download at this link, it'll be provided in the chat. And then we also have an example map, which we refer to as Alvin's relationship map, and that will also be shared for your reference. Next slide, or stay on that slide there. After using the relationship map, you can see who the person wants involved in their life. Being person-centered, you can support the person in a relationship that matters to them, and it can mean working as a team to execute the person's plan like the person wants. Next slide, please. As you look at that first bullet, know that community access is a human right. Are we starting with the concept that the entire day for the person is their time, their choices, their access, that we are not restricting that time unless there is a current valid assessed need? We are not here to talk about all human rights and restrictions. This is just an example. So we'll move on to say, do we believe the Chart into Life Course Framework statement? All people have the right to live, love, work, play, and pursue their own life aspirations. In the community, how are we connecting the person with their community? What people, what place, what ways? Community can mean different things to different people. Online community can sometimes provide a type of interaction that physical communities can't. And the reverse is also true. Are you helping the person to connect with their community, whatever that means to them? Next slide. Here are the skills we discussed today for cultivating connections inside and outside of the system. We encourage you to use the community integration strategies document, the integrated support star, and the relationship map to help you make those connections. Please reach out to our team for any questions, and we will share that email address in the chat. And thank you again for this presentation, and we'll give it to the next presenter.
Thank you, Lisa and Tamara, and thanks so much for taking the time to go over just some best practices or ways to implement person-centered practices. I know a lot of people on the call have been engaged in person-centered planning and practices for a lot of years, and that there's a variety of stages of people kind of evolving with the system as it's evolved. So we really appreciate you helping keeping everyone informed, and making sure you're sharing things that you're learning through the National Center Advancing Person-Centered Practices and Systems. So thank you for the great work that you're doing and for sharing that. We'll go ahead and turn the time over to Camille so she can talk about housing needs, housing issues, and how to support people.
Thank you, Angie, and thank you, Lisa and Tamara. That was a great presentation, and it kind of helped leads us into some of the long-term or short-term housing goals that we can help with our people that we're working with. Next slide, please. So what is integrated housing? Integrated housing is what housing in which a person with a disability resides or may reside that is found in the community, but is not exclusively occupied by persons with disabilities. I really like this quote. Can you go back? Thanks, sorry. Individuals with disabilities, like individuals without disabilities, should have a choice and self-determination in housing and in the healthcare and related services that they receive. Next slide. So this is why we think affordable housing and services are so important. First, it gives options and individual choice to the individuals and what they desire and what their needs are, whether it's improved health, giving themselves more independence, whether they want more stability or security. It's if they feel like they need more fairness, equality, and equity in compliance with the settings, rule, and strategic plan. Next slide. We've found a lot of information through the health services research, and what it shows with people when they have combination of affordable housing and intensive services, and what help it does for the high needs group saved an average over $6,000 a year per person just in healthcare alone. They show that they had 23% less visits to the hospital. They had 33% less emergency room visits and 42% less days in a nursing home. So the research is there to show that affordable housing is a very important component with health services and supports. Affordable housing programs vary by public housing authorities, but the most common are the housing choice vouchers. They are also known in the past as Section 8. The recipient picks where they want to live, and the voucher is portable to another state or to another county. Project-based vouchers are where rent subsidy is also given to the individual, but it's attached to the unit and not the person, therefore it's not portable. There's also the non-elderly disabled vouchers, a family that includes at least one person with a disability between the ages of 18 and 61. They are the same regulations and policies as a housing choice voucher. The only difference is the criteria to qualify. And the next most known is the public housing, which they provide decent and safe rental housing for eligible low-income families, elderly, and persons with disabilities. And you'll find that most of those are owned by the housing agencies in your local communities. Next slide. Housing choice vouchers have also shown to reduce crowded housing, homelessness, and frequent moves per studies that they have received. They are showing vouchers reduce the number of families living in a crowded housing by half. They also show that having a housing choice voucher had reduced homelessness by 3/4 of the people in the study, and reduced the number of moves over a 5-year period by more than 1/3 of what other individuals were doing without the vouchers. So again, the research is showing that housing choice vouchers are an important program to include. Next slide. Why is success needed? Decent, affordable housing reduces stress, toxins, and infectious disease, so which leads to improvement in both physical and mental health. Affordable housing also frees up funds within families, tight budgets to spend on healthcare and food. And some of the keys to success that we are seeing are learning the housing terms, programs, and processes. You can find these programs and they give descriptions of each program on the PHA's websites, which we will be including in the chat. A link to all housing authorities throughout the state of Utah by region, and also follow through. It's not always going to be immediate, depending on the program, but mostly housing choice vouchers are the most important and therefore are going to take the longest to be pulled off the wait list. However, an individual with disabilities will get preference or a priority from a housing agency and will get pulled before others. So their wait will not be as long as you will find in some of the families that will be on the list a lot longer. So it's important to make sure that you're marking that on any applications. Also, updating information with housing agencies and property, their mailing address, email, phone numbers. Most housing agencies will have a wait list update form that you can send in. So if you know if a provider is applying for these housing vouchers, please make sure that you're communicating with them to, if you know that the provider is changing, to make sure that the email or the mailing address that they used on the application for the client, especially if they use their office address, is updated to what the new provider's mailing address is. We are getting a lot of housing agencies that are reaching out, letting us know that some people are losing these vouchers that they've waited long for. It's like Angie likes to put it, it's a golden ticket. These people have waited for years to get this, and they only pay 30% of their income. So someone, instead of having to pay their full Social Security check to $914 of rent, they're only having to pay $200 of their rent, and that voucher covers the rest. And one big issue that we are finding is that support coordinators aren't even aware that their clients are on these vouchers. And so it's really a big, huge communication gap that we're finding, and is so important. The PCP, or going through your PCSP, when you're asking individuals about their goals, is their goal to want to live independently? Maybe they can't live independently at the time they come to you, but they can later. You know, it's really important to make sure you're reviewing this with them and the providers, and making sure that these housing vouchers are applied for, if they're open to be applied for, in the local community of where they reside. And it's also very important to make sure that you are aware that they are on these vouchers, so that people that have them are not losing them because they're moved to another location. They might have a voucher in Utah County, but they were moved to Salt Lake County and no one was aware that they had a voucher. And so they lost the voucher because they didn't notify the housing authority. So we just want to make sure that communication is happening. Also, reasonable accommodations is a big, huge thing to make sure that if you're helping individuals, or if you're asking or answering questions, if they can use their voucher in a shared housing situation, like an RHS setting, yes, they can. And it's very important to understand that. And it's very important to know that you can request that. They have the right to request that through reasonable accommodation, that they can utilize these vouchers in shared housing with other assisted or unassisted individual families. Next slide. Supportive services. Housing choice vouchers can allow, through a reasonable accommodation, a live-in aid of the participant's choice to live with them, or the ability to rent from family due to a person's disability. A person may receive supports and receive rental subsidy. So please keep that in mind, that I had actually a mother who could not find a unit for her son within the amount where he worked and where she had to travel, or where that he could be close to her, because she was still doing the transportation for him and still providing a lot of supports. And she had a basement that he had been living in, and was able, when I talked with her, I said, well, is the thing that he wants to live independent away from you, or is it that you're just wanting him close to where he works, or what's the situation? After talking to her, I found out that it was just that she wanted somewhere close that she could still be able to give him the supports he needs. And so I let her know that through reasonable accommodation, she could request to even be the landlord for her son, as long as the unit was separate and he had his own separate living space. And they sent in the reasonable accommodation. And so she did become the landlord, and through the reasonable accommodation, he was able to rent from his mom and still have her be close to him so he could have those supports. So reasonable accommodations are a very important factor when utilizing these vouchers. Next slide. Is it on the next screen? There should be, there we go. Thank you. And now I'm going to turn the time over to my wonderful housing teammate, Mandy Cicera.
Thanks, Camille. So we're just going to go over real quick on how to input a voucher or really any type of housing assistance into U-Steps. And Camille and I strongly encourage everyone to do this. We've been noticing that because of a lack of communication, people aren't aware that some of our people that we're working with are on vouchers, and thus they have lost these vouchers. So we're really trying to make sure that there's open communication and everybody knows what's going on, and it also helps us track some data. So to do it, you're going to go to the main consumer page, and then you'll go down under the financial section to assistance. And then next slide, please. And then on this page, super simple, straight to the point, under the drop-down menu under assistance type, you're going to choose housing. And then on the description down there at the bottom of the slide, you can just state something to the effect of receiving a housing choice voucher, and then put the housing authority that they are receiving the voucher from. And then you can put the amount, and then if it has an end date, usually they don't really have an end date, it's ongoing. They have a review every year, but so you don't necessarily need to put an end date. Next slide. Well, and that's it. That's how we put it in. So that's super simple. And then just real quick, just go over a review of what the housing team does. So we help people, individuals and families, and any supports they have find affordable housing. We take referrals from the intake, wait list, and people that are in services. We also work with a lot of community partners and government agencies. We advocate for set-asides that are affordable, that have affordable rents, just to build those relationships so that we can have a pretty easy pathway to getting housing for those that are referred to us. We conduct a needs assessment. So when we get a referral, we're going to ask some questions to figure out what kind of housing they're going to qualify for, what kind of housing they want. And then that helps give us a good direction. We also do a lot of informing individuals and families and support systems on their rights, their responsibilities, where they can get legal help, policies and procedures. And then we also do some training for staff and providers and support coordinators at our quarterly table talk specifically, but then in between as well. And I believe that is it. You can go to the next slide. Yep, and there's our contact info. And that is all for me.
Thank you, Camille and Mandy, and really just thanks for helping keep everyone informed. It is really disheartening when someone moves or something happens and they lose their housing voucher. It really does impact their choices, their options, their opportunities, and it's a real loss for them. So it's great to make sure we're keeping everyone informed so that they can have the right advocacy and support around them so that they can maintain the services that they have. So thank you very much. We'll go ahead and go into our Q&A. We had some questions sent ahead, so we'll go ahead and start with the questions that were sent in early. And then we'll go through the questions that have come up and any other questions that come. So the first question, I'm going to read them as they're written. It says, do we know if caregiver compensation will be approved ongoing? If so, will there be a separate provider code with a standard rate approved rather than converting SL3 to SLN, not equivalent, after an RFS approval? So yes, the caregiver compensation has been approved ongoing. It was approved during the legislative session, so it will be an ongoing service. And we have received a lot of feedback from families who are interested in having a provider option, and we're considering all of this feedback as we're finalizing the plan. We've received feedback from support coordinators as well. Once it is all finalized, that will be shared. And we're gathering some additional feedback from families as well. The next question is, what is going on with caregiver compensation, and will there be guidelines for who qualifies? I have a couple of families that have seen an article in KSL and now they want caregiver comp. I don't necessarily think it is appropriate for them, but there is not any real guidance about who qualifies and who doesn't. I feel that some families will just be getting money while their child gets no benefit and just sits in their room with no interaction with the world around them. I understand families that have high needs for their child, and I have a couple of clients that receive SL3 and feel it is appropriate, but others, no, I don't feel it is appropriate. There are no real guidelines to help determine that. This is a good point. Thank you for bringing that up. This is also something that we're considering as we're finalizing what caregiver compensation looks like going forward, what our new caregiver compensation program looks like. If you do not feel a service is appropriate for the person you're serving, it is not something that you should be putting in your plan, in their plan, just as you would with anything else. And I agree, we've had a lot of calls resulting from the KSL article as well. And it doesn't make it really clear for families, but do continue to work on assessing what that person's needs are, how they're best met, how to keep them engaged in the community. I think it's a fair comment to work with the family to help them understand settings. Part of settings is really that integration, making sure people aren't isolated. So that is part of the conversation as well. Our next question is, in one of the last trainings I attended, it was mentioned that video calls to clients would be allowed as visits 6 months after the COVID unwinding completed. Did the COVID unwinding complete the end of April as anticipated? So special allowances like video calls will no longer be allowed after October 31st, 2023. Is it being considered to continue to allow video calls sporadically to help with contact in the midst of illness, emergencies, or scheduling conflicts? It may be reasonable to allow them once a quarter per setting. You all should have recently received an email. The Appendix K does allow for visits, for virtual visits as needed related to COVID. The Appendix K is specifically in response to the public health emergency. It also acknowledged the need to do in-person visits to assure the needs of each person are met. At this point, visits should be in person. For many reasons, based on communication needs, the need to be able to observe the environment, interactions with people, assessing service delivery, the visits need to be in person. We still have Appendix K if there is a reason related to like a need there. You can still complete a virtual visit based on that need. And I hear what you're saying about like having visits. I will say initially at the beginning of the pandemic, I thought it does seem reasonable to be able to have virtual visits as an option. I will say, as we've gone through this for a few years and we have seen some scenarios that really have not been good for people at all. And I mean, many of you can probably think of your caseload or your business where you've seen these scenarios. So it really, really is important to be out there, seeing people, talking to them, understanding their needs, advocating for them, helping make sure things are in a good place for them and that they're in a good place and they're comfortable and their needs are being met. So thank you for this question. The next one is, can you provide the level of detail needed to justify a virtual visit or meeting due to illness? Many families are pushing back, especially those that are immunocompromised or medically complex. These are families that came off the list during COVID and don't have the history of in-person visits prior, so they are resistant. Perhaps a memo from the division to families explaining the necessity would be helpful. I think we have shared this in our family quarterly meeting and we can continue to do that. But we do expect you to be able to make the judgment of when this is needed. It really is looking at why this temporary adjustment was made, how it's needed for that person. Like, we know there are scenarios, like I think an example that comes up regularly is, what if the person is going through cancer treatments? Like, we recognize there is a period of time where that person is immunocompromised, and it's not just your visits, right? It's life in general that's being affected. But this isn't a long term, right? This isn't like a lifetime situation, because the treatment comes to a conclusion. So it really, we are expecting you to be able to use your judgment to do this in the same way you would have before the pandemic. But really be thinking of that person and be conscientious of how to best meet their needs. As I mentioned, we are seeing scenarios that not having visits has not been good for people. So please be thinking of that. So the next question is, where are the specific guidelines for caregiver comp post-COVID? So that's what we're working on right now. That's what we're working on. We'll be putting out for public comment. We'll be getting CMS review and approval on. And then we'll also be working on having kind of a little more detail in how it's being implemented. So we'll make sure we are sharing those when they're all in a finalized state. I know there are questions. We are trying to, we are taking everyone's feedback, and we are trying to not put out like too many considerations so that we don't end up with a lot of misinformation and a lot of hypotheses around what things may or may not mean. So thank you for your patience as you continue to give us feedback and as we continue to work through this. So it looks like the next question is for Carrie. There is confusion over OSR and OQI. Are these separate entities? Is there a separate org chart for each? So Carrie.
Yeah, thanks, Angie. This is a good question. So I think they meant CQI. So the Office of Service Review is within the Division of Continuous Quality and Improvement. Also within that division is the Office of Innovation. So we are all as one, and on the org chart, and I'll have them drop that link in the chat. You'll see it is our whole division, and you'll see the two offices separated out. So that's why our website says CQI, but so we are CQI, we're just an office within that.
Thanks, Carrie.
Yeah.
Looks like the next question is for Kristen. Will the SCE be notified before the SSM funds are removed?
That is a great point. I wasn't planning on doing that originally, but I think that's a great point. We will do that. We will get those emails sent out probably at the same time we send the NOA. So you'll know it's happening, probably not before, but just at the same time that it's happening. So you're aware and that's happening.
Thanks, Kristen. The next one is for you too. If there is no current or projected shortage of SL3 units for caregiver compensation, is an RFS required regardless?
Yes, if you need additional funding for any service, if it's caregiver comp or any other service, you do need to submit the RFS request. to have that service put in the individual's plan.
Thank you. The next question, when an individual on our caseload has a UCANS, can that be counted as the monthly visit, even though we are seeing them virtually and not in person, or does a separate additional in-person visit need to be done? So you just need to make sure you're following the in-person visits as outlined in your contract. So if it's a service where it does not require the monthly visit and you're in a period where you can do a virtual visit, right, that would work. You could also, if you are required to do monthly visits based on the service, you would still need to do the in-person visit, but it could be in conjunction with that, right? You wouldn't have to be virtual for the UCANs. So just make sure you're still meeting the requirements that are in your contract. Okay, the next is for Camille or Mandy. Can housing vouchers be linked to use steps to improve communication?
Yes, we went over that. Mandy went over that with the going through the financial and the assistance link and marking housing, and then what kind of housing they're on. That is where we are putting that information currently in use steps.
Thank you. The next one is for you too, Camille. Are there openings for housing currently?
There are, and if you'd like to know a specific city or county, the websites for the housing agencies, they will advertise any openings there. If the person that asked that question would like an answer immediately, if they know if a county or city that they are wanting right now, I'm happy to answer that for you right now. Or you can go to the websites and they will also advertise that.
Thanks, Camille. The next question looks like it's for Amanda. Says, I thought the person-centered profile was no longer required because it is no longer part of the PCSP document. Or Bryn might have answered that question. So Bryn or Amanda?
I'll let Bryn go through it first, and then I'll explain my thoughts on it.
It might be odd, but I'm okay to defer on this for the specific contract requirement. That's fine. Go ahead.
Okay, it's really helpful. It's an easy place for us to get information really quickly. So we're not going in completely blind. All my team likes to prepare for the UCANs, and that's just an easy one. It doesn't have to be 100% fulfilled out. It doesn't have to be, these long novels. Just a little bit of update information, make sure it's accurate. If it's already in there, just make sure the information is accurate. You don't have to, like I said, we don't need a novel, just make sure the information is accurate.
Thanks, Amanda. And I think that is a very reasonable point to your example previously. It's really important that we don't have misinformation when meeting and talking with people. So the next question is, can we use video calls to supplement in person as long as the in-person requirement is met? Yes, if you're following your contractual requirements for face-to-face visits, additional visits can be done by other means, including video. Okay, the next question is regarding Angie's response to caregiver compensation and the expectation from families to receive 40 hours of services. Support coordinators will get fired if we tell them we don't feel caregiver compensation is in the best interest of their child. It's imperative that DSPD set parameters, much like you do with every other service. This needs to come from higher level than support coordinators. So right now, beyond the Appendix K, we don't have guidance, right? So that is the guidance. And there are a set of questions that you should be using when working with families on that. And we will have parameters when we have caregiver compensation set up as an ongoing service. It has been pretty unique to have it set up as an emergency response to an appendix based on a pandemic or a natural disaster. that has gone a lot longer than we initially anticipated. But we are working, we'll have some parameters in there that you guys will be able to use to assess like the right amount of services and what that looks like for the person. And I do acknowledge that it can be difficult to kind of set up some boundaries with families. And I would definitely like to talk through how to make that more effective and helpful for you as a support coordinator, because we do need that to be functional for you too, so that you can have the necessary conversations with a family about services, about like what's allowable or appropriate within Medicaid, how what the point of a service is. Like, I definitely want to make sure you have what you need to be able to have those conversations and feel like you can have them safely. Because we definitely rely on you as the support coordinator who knows that person the best to be able to have those conversations. So I think that's something that we'll probably need to continue to engage in. The next is, as we assess families' needs, will DSPD back us up and not transfer cases when parents are not given SL3 or other supports that the support coordinator assessed? The family should be told and these cases monitored so that a case transferred to another SCE is not able to override the assessment. I think that's a really good point and good feedback. And we probably need to look at how to like make sure new support coordinators are able to see what assessment occurred. As you know, people get to choose to change service providers or support coordinators. There doesn't even have to be a reason. They can just simply let us know they want to change support coordinators. We're going to allow people to change, right? It's one of their rights. It's an option they have. So when people reach out to change support coordinators, we will continue to support them. I do think, as I was saying before in the last question, it will be helpful to look at like, how are we making sure those assessments are transparent between support coordination agencies, and really looking at how to have some continuity for all of you as you're looking at this, while still allowing you to be able to be individualized in how your agency uniquely, kind of your agency culture, and you support people. Next question, I agree, but parents are going to say they are the best support for their family member. Is there going to be something specific that we can tell families when assessing the client's needs? They can just go to another support coordinator that will give them caregiver comp. I feel like, right, there are a lot of questions along this similar line, and it does. I'm definitely hearing the concern about not being able to serve someone because you don't see you see other services as a better way to meet someone's need. On this, I'm just trying to think about kind of the best way to go about it. I feel like this is something you're going to need to think through a little bit, because we want families' needs to be met, and we do recognize that families are exceptional. Because you're an exceptional parent, it doesn't necessarily mean that providing the service is right. We definitely have scenarios where families, like, we don't want to see a family getting burned out because they're providing the caregiver compensation when what they really need is to be able to have a reprieve so that they can regenerate and continue to be that exceptional parent. Right? There are a lot of dynamics and reasons that could go into why someone may or may not be able to. And this is why I was saying earlier, like, you know, the family best, you know, that person best. You know, if a parent is like taking care of their aging parent as well as a child, and you'd really have to assess, like, will this meet that child's need, and will they be able to, like, is this sustainable for that family? And I think that is the type of conversation you need to be able to have with parents and with families. Because this is about supporting the individual, but we also want them to thrive in their families. So this is something that I think we'll need to continue working on. The next question is, could you please explain why support coordinators are needing to continue reviewing and approving the timesheets versus other SAS services? SAS representatives send their other timesheets for other services directly to the provider versus support coordinators reviewing and signing them. If there is a reason for this, according to the timesheet, this implies that SCEs are the employer for this particular service. Could this be something that possibly could change? As we are already authorizing payments, the process maybe seems redundant. Thank you. So there is a reason for this. Right now, when parents are approving timesheets, it's not their own timesheet. So with caregiver compensation, when a parent is both the SAS administrator and the employee, support coordinators were identified to be reviewing and approving those timesheets. And this was, as I mentioned earlier, this was one of the ways as we were looking at how to implement something quickly during the pandemic, trying to like bridge a gap and meet a need. This was one of those solutions. And this is something that we're looking at too. We've definitely received this feedback from support coordinators already, and we've taken that into consideration as we've been working on how to do this moving forward and what that looks like. So thank you for bringing that up. And that is the reason, and we are definitely looking into that. The next question is, can you provide some guidance in regard to the expectation in monitoring and reporting settings issues? Bryn, I'm wondering if you are the one who would be the right person to answer this, or I don't know if we have Heather or Joseph on. Or Carrie. Looks like Carrie, I don't know if Carrie was ready for this one.
Well, I saw it, so I can help, and then Bryn and anyone else, please jump in. But we are in the middle of working on some contract language to make it more clear as to support coordinators' responsibility in regards to their to settings compliance and the role that they play. In the meantime, though, we have been having meetings between our office, DSPD, and the settings group at the long-term services and supports to just train on the settings rule with support coordinators and kind of go through those expectations. So if you want us to come out, feel free to reach out to us and we can get that set up. We can go through what settings rule is, some things you can be watching for when you do your home visits and in-person visits. And then if you do have concerns, you can share them with our office, which is osrprovider@utah.gov. You can also send them to HCBS settings@utah.gov, and we'll see if we can get those added to the chat so everybody has access to those. Bryn, anything else you have to add to that?
Just that contact information that you already shared, and the fact that it doesn't always need to be in person. We could certainly do some virtual TA if there's some additional questions as well. But you can reach out to any of those. Constituent services would be a third option if you can't reach the first two. We all work together to answer these questions, but more information to come on support coordinator responsibilities there.
Thanks, Carrie. Thanks, Bryn. So Kristen, we have a follow-up question for you. I have clients using SL3 and there is no current or expected shortage in their current plan cycle. Is an RFS necessary to continue SL3 in these cases?
Sure. And thanks for Claire putting your question back in, because I think I did understand it wrong the first time when you put it in there. But if there's funding available in their plan for SL3, they don't need to submit a RFS to just continue using the funding that's available in their plan. When we switch to the ongoing program and we have new guidelines, there may be a possibility at that point that they would need to switch them to ongoing funds from one-time funds, but that hasn't been finalized. We don't have that out yet, but we'll let you know when that situation occurs and if they're needed at that point.
Thank you, Kristen. The next question is, I think, for Bryn. Why is it excluded from the PCSP person-centered profile?
Sure. So I don't have a quote or anything of that nature, but currently the person-centered profile is still a required thing to update, support coordinator responsibility. If something changes in those support coordinator requirements, DSPD is going to provide some updates to you in that area.
Okay, the next question is for me. Where are those questions Angie asked while you were talking about DSPD setting parameters around caregiver comp? I'll have to go online to find those questions. I feel like those were developed early during the public health emergency. I know we have referred to them in the past as well, so I'll have to go find those. So the next question is for Amanda. Amanda, in reference to your team preparing, I would hope that they receive the same message and understanding their task. The last UCANs I participate in, the evaluator was reviewing the cultural factors domain and told my client and her mother that this domain had to do with whether the client was transgender. It was awkward for me as I didn't feel it was appropriate for me to jump in to disagree with her. She expressed surprise when the mother told her that the client had autism. The evaluator stated she was unaware of this, yet it is written everywhere in the USEP's information.
And unfortunately, sometimes we get back to back, we get busy, we're not able to thoroughly review. It unfortunately does happen, but let me know if there's any issues like that, and we can definitely address it. We go over different areas of the UCANs often at our team meetings. And while being transgender could be part of the cultural concerns, it's not all encompassing. So it's definitely something we can work on some more.
Thanks, Amanda. Next question, another caregiver comp. If the parent doing caregiver compensation is not the employer, does the SCE currently need to sign timesheets? It was my understanding that they do not, but Morning Sun is requiring me to sign the non-employer's SL3 timesheets. So when it was set up, if they're not the employer and administrator, we were anticipating that that employer or administrator would sign off. Again, right, we're still operating under Appendix K and anticipate this will be different after. So originally the anticipation was support coordinators would not. And I'm not sure why Morning Sun would be requiring it. It could just be something they have in their system. I don't know, Kristen, if you have any other insights there.
I don't at this point, but we can follow up and find more information if needed.
Okay, thanks. Okay, I think one more question on the person-centered profile. Just to follow up, they're wondering why the person-centered profile is no longer included in the PCSP. So in looking at this, it sounds like perhaps you want it to still be in the person-centered plan. We can definitely take it back and evaluate that. I know there was a lot of assessment. There was input from support coordinators, from people with disabilities, from providers as we worked to develop this. There was consideration about like what tools such as the charting the life course and others, what's captured in those, and just kind of thinking through what would make sense to be required. But we can definitely evaluate that. I feel like this has been good feedback, especially if it's something that we're continuing to utilize to keep us informed. So thank you for that. That brings us to the end of the questions. I'll go ahead and, okay, it looks like we have one that just came. Okay, I thank you for that. It's really good for us to take that into consideration. Okay, so one more question on virtual visits. Can you please state once more if a virtual visit is approved to perform one single month if a client is immunocompromised? And this is exactly like, this is what we're hoping would be understood from the email we sent, as well as just as we've talked through this today. So this really does need to be like, you'll need to be able to like use your best judgment and just be able to capture why. Like, virtual visit done, this is why it was done virtually this month due to this immunocompromised risk for this person. And so that's really, as we've talked to Medicaid, and I don't know if Joseph is on here, but as we've been, because I can only see so many people on my screen. But it really is about like how you would have done this even before the pandemic. So let's say you were visiting someone monthly, they were going through a treatment that created an immunocompromised situation. They're really like not going out as a result, not having like parties or gatherings at their home as a result. Like, be looking at it in the same way you would have been thinking about it prior to the public health emergency. I don't know, is Joseph on, or someone from Medicaid?
Yeah, Angie, I'm on.
Okay,
And I agree with everything stated. In addition, CMS has also asked for, in order to make some of these provisions a little bit more permanent, they've also asked us to consider the nature of requirements like HIPAA as it relates to telecommunication, making sure that the individual has the capability to disable or enable two-way communication devices. So I think there are some additional pieces that will be forthcoming with guidance in the future. But I think these are precisely kind of the one-off situations or the exceptions that we're looking to address when it makes sense for the health and safety of the individual.
thanks, Joseph. Okay, we have another question is for me personally, I don't mind if it isn't in there, but why are we updating it if it isn't in there? A lot of that information is already in other areas. Thank you. I definitely feel like this is the message I'm getting, is like evaluating if you need to continue to update the person-centered profile when we're not requiring it as part of the plan, and do we really capture everything that's needed in other places? So that we're all prepared when engaging with people, when engaging with families. So thank you for that feedback. And Bryn, I'm just gonna ask you to like keep track of that so that we can get together to take our next steps there.
Absolutely. We're meeting weekly on this, and I was already intending to
Thank
take
you.
all of that feedback.
Awesome, thanks.
Steps group, so. Yeah.
Okay.
We'll do it.
Thank you, Bryn. I don't know if we have Rick or from someone from USEPS on. It says when we link documents to the PCSP, they are not showing as being linked. And if we don't have any from USEPS on, we'll make sure we take this information to them.
We can add in the chat. This is Bryn. We can add into the chat some emails. You can send that specific question to.
Oh, perfect.
To just provide TA, or we can do a call and answer that. You have to go into the attachment section and choose which version of the attached documents you'd like to include there. But if there's a glitch, we'd like to know about that and talk with you. So we'll add those email addresses to the chat.
Thank you, Bryn.
Angie, this is Brenda Collister. I specifically talked with a couple people from USteps actually, and they talked with me about this specific question because I couldn't figure out how to get a planning tool to show up in the planning tools section that the provider had given me. And they said that unless you actually complete the planning tools that are in USteps already, the blank tools, it won't show up in there. They are in the attachments section, assuming you upload it into UPI, but it won't show up in the planning tools section. And I don't know if the providers have access to that attachment section or not. I didn't think to ask them.
Okay, so it's something that providers are uploading, not something that you're uploading as a support coordinator, and then it's not kind of linking over.
No, the provider sent it to me and I
Okay.
uploaded it into UPI. But the section that's the planning tools that DSPD has built into the system,
Mhm.
you have to if it's going to show up there, you have to actually use those tools if it's going to show up in the planning tools section. Otherwise, it only shows up as an attachment.
Oh, okay, I got it.
So
Maybe
Brenda,
I can address that for you if you want.
Oh, there we go.
So the planning tools were intended to be done in USteps and not uploaded as an image document when the PCSP was recreated. If you want to upload a planning tool that was not created in USteps as an image document, then that goes into a different part of the planning process. And it could be that when you're talking to whoever it was in the USteps team, they were confused about what you meant. But if you want to get with me, I can help you understand what to do.
So can it be uploaded into the planning tools section?
it can.
It's uploaded in a different area of the plan. It doesn't go into pre-planning tools because the pre-planning tools are specifically devoted to the data entry perspective, not an image document. The image documents are loaded in a different place of the plan. But give me a call and I'll help you do that if you want.
So
Gonna be getting lots of calls now.
I have a follow-up question for Brenda too. So Brenda, it sounds like because it doesn't go there, it's a little bit hard to track down and tie it to the plan. So finding a way to be able to do that, is that a reasonable
I mean, like,
understanding of the question?
as far as
So when
as
you're
far as
up-
providers seeing it, yeah, it's not specifically tied to the plan because if you go in the attachment section, there are a whole bunch of them. But it sounds like Rick knows a way to do that. So maybe I'm just not informed. I'm not sure. Maybe others know that secret methodology, secret to me at least. Maybe others don't know it either. I don't know.
Okay. All right, thank you. And thank you, Rick, for being available to walk through that. And then whatever we learn, like maybe we're learning from it that like we'll have a clearer understanding and need to continue to consider how to make it most available to everyone, especially as we continue to look at how to further develop my steps for people to have access and visibility to their plans. Okay, our next question looks like it's more of a comment. It says, I think DSPD needs to take a close look at what you want our priorities to be as support coordinators. I have spoken to so many support coordinators that feel that cannot perform quality services because of the scope of work DSPD has added to our jobs over the last 3 years. Now that we are back in person, our travel is making it hard to fit all of the meetings, visits, ensuring safety, and meeting paperwork deadlines. If our jobs are to ensure health and safety, then our time needs to be for out in the field assessing environments and supports and having time to have those conversations and advocacy.
Hi.
Hello? Okay, I think maybe that was unintentional. And having time to have those conversations and advocacy versus filling out multiple forms and paperwork that are redundant. I'll just let you know we're having very similar conversations. We're really looking at how to keep things efficient and really assessing how to make sure we're getting quality services for people, as well as making sure we're meeting all of our accountability. As you know, we have our OIG audit. It will likely have some effect on how we're documenting and tracking information as we respond to them. And everything we're looking at, we really are considering like, how do we get what we need? while being sensitive to everyone's job requirements. It is really essential for us to be able to respond and address the concerns that have come up, because they are, right, they are overseeing Medicaid implementation, how we're implementing services as a system as a whole. And it's really critical that that funding for us is very critical. It helps us serve significantly more people because we're able to get that match. So we do need to make sure we're meeting all of the requirements. And we are looking at, like, how do we make sure we do that while making sure that we're not creating unnecessary work. So thank you for that feedback. The next is, how do we assure health and safety as well as the settings role, because they are often in conflict with each other. I'll give a little comment, and then I think Bryn, if Heather is on as well, feel free to jump in. But the settings rule allows, I mean, it just helps us all recognize and recall people have the same rights and entitlements as any other person in our communities. Sometimes it can be hard. A person can be making a selection that looks like a bad choice to us. So we need to continue working with them to educate and inform, but also identify those risks. There is a method to still have a rights restriction. But again, it just is really looking at coming from the point of the person, right? How is this affecting them? Is it essential? How do we mitigate the risk that is out there? And what is reasonable? People have the right to make choices that have some moderate risk, right? What is the dignity of risk? I'm not saying we're going to have someone go operating a train without any training, but we do need to support people to learn, to experience life, to be able to make choices. And then when there is a significant risk, that is when we're having to step in with a rights restriction. And I know a person can just say no, I don't agree to that. And if a court hasn't told us to do it, they have the right to say no to that. But please continue to work with a person, continue to give them options. I know some of these can be challenging, as we just had a phone call yesterday about something similar. I think sometimes these are also scenarios when people are requesting support from USDC to be able to help address behaviors or health choices that people are making. Please just continue to work with people. And I want to, part of what you're assuring is health and safety, but as you noted, it is really, our lives are more than just health and safety, right? There are relationships, there are things that enrich our lives, there are things that are quality of life centered, what helps us thrive and just love to be here. So that is definitely part of this. I don't know, Joseph, if you have anything you want to add, or Bryn.
I can jump in here. Angie, that was a great summary. I lean back on the statement that the settings rule came because individuals wanted more choice and control over where they live, work, and socialize. It emphasizes community inclusion overall. It emphasizes person-centered planning, emphasizes informed choice, it emphasizes employment, right? And so, yeah, really that's what we're doing here. We're giving equal weight when we talk about person-centered planning in terms of what's important to that person, as well as what's important for them. That health and safety wise, at times that might mean a rights restriction. It might not mean a rights restriction. We might be providing support to that person and redirection. So it's all handled on an individual basis. And we'd be happy to help if there are questions that you have about a particular individual situation, both from any level here. The Division Human Rights Council is another resource to help work through some of these questions as well.
Joseph, anything to add?
No, no additions from me.
Okay, thanks. I know we have a few more questions that have come in. We're at time, so we'll go ahead and make sure we work through those questions. If you have any additional questions, send them to DSPD info. And just thank you for attending. Thank you for your feedback and thank you for your partnership. We do want this system to work for you as well as for the people we're serving. Our next quarterly meeting is October 18th at 11:30. And for those of you who are interested, our next family and self-advocate meeting is Wednesday, August 9th. Again, thank you for your time today and have a great week.